Deputy Gerry Adams, thank you.
Gormagad can Corda Tishak. Taturs can we and you all are in Arish, who are Goras Slanta a Brassak. It's son of a van Shockton on Nur Knockclishin Wedge, Drug Scale, Queen Service, Slancha, Ata or Foyd and Winter and Stoich. Tishak, you're probably aware that significant concerns have been raised about overcrowding in the state's hospital emergency departments, and a letter from the Irish Emergency Medicine Trainees Association. Now, these are senior doctors operating in emergency departments, and they're deeply concerned that trolley numbers remain extremely high, and in the past 2 weeks these trolley numbers have exceeded 300 a day. The association also claims that the May 2012 HICFA Tala hospital report recommendations on overcrowding are being ignored by senior hospital consultants. Now, this is a scandal if this is accurate, Taoiseach. Over a year after the HICFA report, severe overcrowding remains. Patient safety is obviously at risk. Quality of care is being compromised. And the letter says that the appalling conditions, not my words, not an opposition or a Sinn Féin spokesperson's words, but this from professionals, the appalling conditions that our patients endure in emergency departments should not go unchallenged. We also learned from the Irish Nurses and Midwives organisation that today, this day, as we sit here, 394 patients are on trolleys in emergency departments or wards across the state, and 308 of these are in emergency departments. And meanwhile, the head of the HSE has said quite bluntly that the money being allocated for the health service this year will not be enough to deliver the services required. So, Taoiseach, what passes for a public health service is crumbling before our eyes and under the watch of your government. So will you commit today to providing the necessary funding to the 2014 HSE service plan, and will you further commit to reverse the disastrous health cuts that Minister Reilly has been responsible for?
Thank you, Deputy.
Well, your comments about the edifice of the health service crumbling is an insult to those who work in the frontline services in every hospital across this country. Anybody who has had the opportunity to go and sit in an emergency department and see the work that is done there by people, yes, in challenging positions, but don't come in here, don't come in here, Deputy Adams, and tell us that this is crumbling.
To stay quiet, please. Thank you.
You above all people who decided to fly away to other pastures to have your treatment, good luck to you, carried out there for you. I'd make the point to you that the number of trolleys in hospitals is 40% lower in the first 2 weeks of this year than compared to 2 years ago. The number of patients counted on trolleys was a third lower last year compared with 2011. That's 30,000 fewer patients waiting on trolleys. Now, Deputy Adams, every year since we began to count issues in hospital, every January, why was it that you always had a spike in numbers waiting in hospitals? Why was it? It wasn't until Minister Reilly actually set up the special delivery unit that it became apparent that in many hospitals, when professional personnel went away for a week or 10 days in January, that the cover wasn't made available to keep things moving through. Now, I have to say this year is no exception, and there are bigger numbers of elderly people having been admitted to hospital. Now, your figures, insofar as I can see, are not correct here, because at 8 o'clock this morning, on the 21st of January 2014, the number of people in a national total was 341, and at 2 p.m. today, that was 210. So it's still too many, obviously. But the impact made by Minister Reilly in actually dealing with this deliberately has brought about very substantial improvements in the situation insofar as patients on trolleys are concerned. And I can also confirm to you that the comment that you make about HICFA will be investigated to see if the recommendations are being implemented, and we'll report back to the House on that, Deputy Adams.
Deputy Adams.
Well, Taoiseach, let me thank you profoundly for your concern about my personal health. which you repeat ad nauseum every time I ask a question about the health services. And it's very, very touching, Taoiseach. It's also none of your business. Let me also say, in terms of the health workers, the health services, the people who are...
Sorry.
People,
Please.
the
Would you
people
please
who
stay
work,
quiet? Thank you.
the
Thank
people
you.
the people who work in the health service have my utmost respect and admiration, because they work under dreadful conditions, and only for their competence and for their love for the job they're doing and for their commitment to the job they're doing, we'd be in a worse situation. Now, you ignored the question. I'm pleased that you're going to investigate the claim that the HICWA Tala report of 2012 has been ignored, and I look forward to getting a report back on that. But look, Taoiseach, this government, in terms of frontline services, lurches from one debacle to the next. Last week it was Phil Hogan. This week it's James Reilly again, and he'll be back again and again. One controversy, one debacle after the other. And the health service was already at breaking point before the HSE service plan. So, 4 billion euros have been taken out of the health service since 2008. Fianna Fáil, Fine Gael, Labour, cosy consensus for cuts.
Thank you, Deputy. You're over time.
At that. Now, let me just say this, and I'll finish in this, Concordia. Thousands of citizens face the loss of discretionary medical cards this year, including seriously ill children and children with disabilities. The prescription charges have been trebled by your minister, who condemned them when he was in opposition. And there are, this is an amazing figure, 375,000 citizens are on outpatients waiting lists. And that's why I say the sense of a public health service is crumbling on your watch. And people demand a radical change in direction of your government's health policy. So, Taoiseach, against the background of, bonus and backhanders and all of that, will you please listen to what the patients, what the professionals are saying, and will you change direction in your government's health policy?
Well, your personal health is none of my business. What is my business is that you are the elected leader of your party, and you're here in the House properly so, and you make comments that the health service is crumbling, that the people who work in it, despite their competence and their love of the issues involved, they're not good enough for you.
Thank you.
Actions speak louder than words.
So,
Thank you.
So you can see my concern for your well-being and for your health.
Thank you.
I'd say to you, Deputy Adams, later this week, in respect of the emergency, in respect of the waiting list position that you mentioned, the Minister will publish the figures. I think even you will be surprised at the extent of improvement in persons having to wait for very long periods for attention in Irish hospitals. And I hope that when the figures are published this week, that you will appreciate that the staff involved and the professional staff involved have made very significant improvements in people having to wait for very long periods. And the Minister is going to follow that through over a period with being able to determine just why waiting lists are so long in some cases and not so long in others. And that's an issue that patients are entitled to have information about also. So I don't accept your weekly assertions that the health service is crumbling. It is a challenging period, and the Chief Executive of the HSE has said that quite clearly. Every year is challenging in health. The monies allocated this year are very far short of what was allocated during a previous time when money was so flourishing that they declared an end to all national emergencies, and yet the service did not measure up to what's being delivered now, having extracted those costs and people delivering so much more, the frontline services and their belief in being able to deliver in patient care. You mentioned about the medical cards, and the government made a decision this year to give free GP cards to those under 5. Mr White's dealing with this. The parents of 240,000 children will benefit. And we move to a point where every person in the country will be entitled to GP coverage as we approach the time to introduce universal health insurance from 2016 onwards.
Thank you.
So there's a major restructuring going on here, Deputy Adams, and it's in the interest of extracting costs but not lessening the quality of service. It is about patient care and seeing that that's able to be delivered. And the group system introduced by Minister Reilly is far more effective in terms of the regions where hospitals exist, so that they can give off their best in terms of all those services for the patients who are their first priority and have to be.